It is 9:20 and we're looking at the week's health headlines.
Joining us is our morning news medical contributor and Northwestern medicine physician, Dr. Lauren Streicher. Good morning.
Good morning.
Good morning.
Well, I love walking and walking for miles on end, but just such good news. I only need 7,000 steps a day.
Isn't that great news? It's interesting because if you ask most people, how many steps do you need to take to stay healthy? Most people are going to say 10,000. And it turns out that 10,000 step of day rule was never based on science. It was actually a marketing tool. There was a Japanese company like back in the 60s that made pedometers. So they came out and said, you need to count steps. You need to do 10,000 steps. You need to buy our pedometer. So it was never scientific. So there was just a huge study, and Robin, yes, good news. It turns out that you really only need 7,000 steps a day to stay healthy. And in this study, there were over 2,000 men and women. They followed them for over a decade. And after they accounted for things like, risk factors like smoking and obesity, what they found is, and this is striking, that middle-aged people that take at least 7,000 steps a day are up to 70% less likely to die from any cause, but in particular, lower risk of premature death from diabetes and cancer compared to those who took fewer steps. But, so what the question that begs is, well, does that mean it's worthless to only get in 2,000 or 3,000 steps? And the answer is no. There's benefits to that as well. The health benefits continue to increase the more steps you get in there. But it's once you get to that 7,000 range that it kind of levels off. And after 10,000 steps, there really isn't a whole lot of benefits. So this is doable. Even just normal everyday activity is about 5,000 steps. So push it a little bit. Push it a little bit makes a big difference.
Next subject, smartphones and cardiac devices.
Yeah, so this is really important information for anybody that has a pacemaker, an implanted defibrillator known as an ICD. Last spring, the FDA put out this first kind of preliminary warning that, maybe your smartphone might interfere with your pacemaker. And specifically, the concern is that the newer smartphones have this magnetic field, which can switch the implanted device to standby mode, which means it's not going to kick in when it's needed, when there's a problematic arrhythmia. So the FDA studied this, and a new study just came out to look at specifically which smartphones, which devices are the problem. And what they found is that any device that has a static magnetic field greater than 10G can interfere with normal pacemaker operation. So a couple of recommendations. One, you need to keep your cell phone and smartwatch at least 6 inches. 6 inches is the number away from your implanted medical device. So obviously not a good idea to put your phone in your pocket over your medical device. And you can also check it out by checking your home monitoring device to make sure that it's not in standby magnetic mode.
All right. How about news about screening for ovarian cancer?
Yeah, so this is not great news. Ovarian cancer is not the most common gynecologic cancer, but it is the most common cause of death of all the gynecologic cancers, and that's because early detection is so limited, and when most people get diagnosed, it's at a later stage and it's more difficult to treat. And unlike cervical cancer that you can detect with a Pap test or colon cancer with a colonoscopy, there is no really good test to reliably detect early ovarian cancer. And a lot of women request and get an annual CA-125 blood test or a pelvic ultrasound for reassurance, but it's really never been shown to decrease the number of deaths from ovarian cancer. So there was a new study that was just released to really look at this carefully. And this was a huge study. It was over 200,000 low-risk women that were screened annually with the CA-125 blood test and a pelvic ultrasound. And unfortunately, in this very large group, there was no significant reduction in deaths from ovarian cancer. So bottom line, if you are low risk, that's important. If you are low risk for ovarian cancer, meaning you don't have a family history of ovarian cancer, you're not having symptoms that might suggest ovarian cancer, there's really no need and no benefit to getting that annual blood test or an ultrasound. So hopefully, there's a lot of research, hopefully there'll be a new and reliable method coming out soon, but right now, not the answer.
All right, thanks, Dr. Streicher. For more, you can follow her at drstreicher.com and on social media. Thank you.
Thank you.
Thank you.
Time for On Town. Hey, Jeff.